Today, I hosted a debate/discussion between Dr. Mark Ettensohn and Dr. Peter Salerno. Dr. Mark Ettensohn is the author of Unmasking Narcissism, and he believes that trauma is more the cause of pathological narcissism, and he believes that narcissism is much more defensive in nature. Dr. Peter Salerno, he has a new book out titled Cruelty by Nature, and he believes that trauma alone is not sufficient to cause a personality disorder, and he believes that narcissists act much more intentionally with what they do. We also touched on other areas of disagreement, such as, are all narcissists insecure, and what is the heart of pathological narcissism. With that, I hope you enjoyed this debate/discussion between Dr. Mark Ettensohn and Dr. Peter Salerno as much as I did. Let's first begin with defining pathological narcissism. Peter, how do you define pathological narcissism?
It's a good question. I want to preface what I'm about to say with pathological and narcissism. There are so many different definitions for them, even in the clinical world. So a lot of that's linguistic convenience. A lot of that's different people having different theories. So I would first of all want to clarify that when I use the term pathological, which has multiple meanings, I would say that pathology can refer to something that, markedly deviates from the norm, right? So we also can look at pathology as illness or sickness, but we can also look at it as something that significantly deviates from what we would constitute as average or normal. And as far as narcissism, I've used the term narcissism to describe the categorical definition of narcissism in NPD. I also have extensively researched what's known as trait narcissism. So my stance, at least now, up to this point, is more seeing narcissism, pathological narcissism, as sort of like a heritable configuration of certain traits that at the extreme end of the quantitative dimension, let's say, are significantly influenced by temperament. I see narcissistic traits also as related to social strategy. And I would say that it's primarily an issue related to grandiosity, which I think can get oversimplified. There's a lot to grandiosity, but I'm sort of following now what's known as the alternative model, the dimensional model, that kind of sees pathology as operating on a continuum, and there are certain traits that make up what we would consider narcissism. So that would include grandiosity, that would include a lack of empathy, that would include attention seeking. And I see it more as a combination of sort of a heritable trait profile that some people are just, imbued with. It's in the genotype. No fault of anyone. It's just happens to be that way. There's enough, we'll say, polygenic risk factors, enough differences that create sort of a severity of grandiosity and a constellation of traits that I would refer to as narcissism.
How about you, Mark?
Yeah, I think Peter's model that he just forwarded overlaps with mine in some ways. I guess I would say I would define pathological narcissism as a dysregulated self-esteem system, accompanied by identity disturbance that involves, at least some of the time, grandiosity, but is also accompanied by what we would call collapse or vulnerable symptomatology, and also the presence of maladaptive coping strategies, be those intrapsychic or interpersonal. So it's a little bit different than what Peter's putting out there. It seems to me that he's describing pathological narcissism as a disorder of extremes, right? That's kind of the dimensional piece of it. I disagree a little bit with his characterization that we could call things that deviate markedly from the norm pathology, because then we'd be calling like geniuses and savants, pathological. I think that it has to be accompanied by some kind of deficit or disability, some kind of distress, some kind of, what we would kind of define as pathology, right? An illness of some kind. That can be functional, it can be brain-based, it can be psychological. To my mind, pathological narcissism is a combination of all of those. So I don't want to try to cut out the heritable factors because I think they're real, but I also don't want to overstate them and to the exclusion of the contribution of experience, which is also real. And just in my experience as a clinician, and maybe Peter can speak to his as well. It just doesn't make any sense to me that many of the individuals that I've seen in clinical settings got there as a result of pure or mostly heritable factors. I don't even know, Peter, if that's the hypothesis you're putting out. I think I might be mischaracterizing your position a little bit, and if so, I don't mean to. But I think we try to take the temperament out at our peril, and I think we try to take the function of experience out at our peril. I think it takes both to produce the cohesive syndrome that we would call pathological.
What are your thoughts on that, Peter?
Yeah, I would agree with that. I don't want to overemphasize either, really. I think something that, to be quite honest, when I started kind of delving into, like a multidisciplinary perspective, and I started, exposing myself to research from fields that I, was not aware had mattered much to psychology. I, wasn't exposed to in my degree programs or in my supervision or my training or any of that, like behavioral genetics and neurobiology and things like that, which we don't necessarily need to practice clinically. I was pretty astounded at how little I knew about contributions to understanding human nature and behavior. And it was kind of, I felt disillusioned because I very much was, psychodynamic to my core. I went to a psychodynamic program. I also earned a 2-year certificate in psychoanalysis post-grad. Fascinated with it. So this journey to me, even considering anything related to, heritability and traits and stuff, was kind of actually heartbreaking in a way, because it forced me to come to terms with things that I didn't really want or ever felt like I needed to incorporate in my clinical lens, if you will. So I by no means am throwing out the environmental influence on especially formative years. However, something that really struck me was the exceptions to this idea that a certain parenting type or style can sort of predict an outcome. And I was very curious about why are these parenting styles or types, if they are so associated with narcissism or any kind of psychopathology, why are there so many exceptions to that when we see somebody grow up? Why are there individuals who I would consider pathologically narcissistic who really don't have a history of trauma in the ways that we say are causative? So these questions kind of brought me into this area of sort of exploration. And what I discovered is there is a lot of research out there in other fields that is sort of controlled and that is sort of saying, well, psychology is it's legitimate. However, a lot of it's anecdotal, a lot of it's theoretical. Here's some things that we know that we can control and replicate that are sort of like irrefutable, and we at least need to bring that into the discussion. So anyway, I don't want to be too long-winded on that, but
any thoughts on that, Mark?
Yeah, I was just having a thought, and then it got up and jumped out of my brain. Just give me a moment. Yeah, what Peter's saying about the seeming absence of trauma in the early histories of individuals with diagnosable NPD, let's say. I think that's just such a complicated topic. I mean, I was reading an article just the other day from 2022, and they were talking about the different factors that contribute to NPD, and their conclusion was basically there are many paths to NPD. There's not just one kind of childhood that produces this disorder. It's not just one kind of parenting, and I think attempts to sort of characterize, like the prototypical narcissogenic early environment, I think they inevitably fall short. Now, part of that has to do with how we define trauma. Part of that has to do with how we define narcissism. Part of that has to do with the limitations in our ability to really gather this kind of data. We rely on self-reports, but that intersects, as we know, with the individual psychology, right? People can suffer complex relational trauma that's devastating and have absolutely no idea what they've been through because that was the air they breathed. I mean, it didn't strike them as aberrant in any way. It can also intersect with defensive constellations. People can actively, unconsciously minimize the amount of distress that they were in during critical periods of their development. We know that happens in avoidant attachment styles, for instance. There's poor recall for emotionally charged situations. There's a tendency to provide this kind of like two-dimensionally positive characterization of their childhood. Oh, my childhood was great, right? That's a common feature of attachment interviews with dismissive, avoidant individuals. And that overlaps with NPD. That attachment style is a factor in NPD. I think also, if you talk to the families, right, the parents, I mean, they're okay. Maybe they're a reliable reporter, probably not. It assumes that the kinds of traumas that are instrumental here are easily observed and recognized by outside observers. And I think it also calls into question what we mean by trauma. It's not necessarily like life-threatening trauma. I consider trauma to be another word for injury, basically. One big injury can be life-altering, but so can a lot of little injuries that collect over time and gradually impair a person's ability to function. It's true for physical injuries. It's also true for psychological ones.
So let me stop you there too, because I'm going to get you into a more area of disagreement here as well.
Yeah.
So Peter has said that trauma alone is not sufficient to produce a personality disorder. What are your thoughts when he says that?
I don't know. That's my honest answer. I don't know. I could imagine a scenario where a person was so badly abused or so profoundly neglected it could produce a personality disorder in the absence of heritable vulnerabilities. I think the data, for the most part, converge around 40 to 50% variants accounted for by heritable factors in personality disorder in general. So, I mean, and it depends on the study and it depends on the heritable factors we're looking at and blah, blah, blah. But, I mean, it would be silly to say that that heritability isn't a factor, because it clearly is. The question is, how much of the picture does it take up? To my mind, heritability it informs the nervous system that you come into the world with, and then experience acts on that. And in the absence of adverse factors, I think you'd be hard pressed. I would be hard pressed to agree that it could result in a diagnosable personality disorder. I think traits and temperament describe tendencies, but not dysfunction. I think to get to dysfunction, to my mind, dysfunction is injury. To get to that, you need to have been injured.
And what are your thoughts on that, Peter?
So when I think about traits, I think about from an evolutionary perspective. I think that these traits needed to be extreme in certain historical contexts in order to adapt and survive, right? And I believe traits are passed from our ancient DNA. Traits survive because they serve an important purpose. I think what I would call disorder related to personality in certain contexts wouldn't be considered disorder. It would be considered a necessity, right? I mean, you need somebody, we'll just say, callous and ruthless enough in certain contexts to protect people. You need somebody willing to merge instantaneously enough for when we need to procreate. There's legitimate purposes for the the extremes of these traits. I would say that the people who are exposed to trauma, who already sort of have that inherent trait profile, and again, we would have to define trauma. You're defining it as injury. Maybe any sort of not only adverse experience, but I would say just experience in general too. People select and modify their environments. I would say if somebody has the propensity to be pretty entitled, and then they start experimenting or exploring with that in relationships, maybe they see how far they can push somebody and then it benefits them. I would say it's almost in their nature to continue to act in that way. And then they're literally cultivating environments where they're practicing being entitled. So I would say that that's really why the trait, I don't want to oversimplify it and say that I believe that these are just strictly trait-based disorders, but I would say that, but you would need that trait profile in order for the trauma or the environmental experience in general, the non-shared environmental experience, let's say, even like outside of the family. I would say that I would be hard pressed to find somebody who didn't have those traits already in them in a certain degree for that to be kind of developing into what we would call personality disorder. And I would also extend personality disorder to refer more to not something that's symptomatic, not something that results just from experience, but sort of like the entire operating system of the person, the entirety of the person, which is why we distinguish them from symptomatic conditions like PTSD and other trauma-related conditions or anxiety conditions. It's not just, insecurity, inferiority, defenses at play, as far as I'm concerned. I believe that there's intentional strategies, maybe fueled by these traits, and then environment certainly influences that. But we also have to remember that when you have these traits, just like we all have certain traits, that also informs how we perceive and respond to our environment. So somebody who has a pretty significant degree of entitlement is going to perceive social interaction and respond to it differently than somebody who was extremely avoidant, let's say, or extremely timid.
Any thoughts on that, Mark?
Yeah, I mean, I think, every child is different, right? Even in the same family, even to a certain extent, identical twins. There's, experience acts upon the system, and it brings out differences, differences in gene expression, right? I think there is, I saw a comment the other day on my channel where somebody said, I had 2 kids and I loved them the same, right? One's a narcissist, one isn't. Explain that, right? And I was like, well, I can't, I don't know. Yeah, I don't know you, but to the commenter's point, I think I would say, well, love isn't a static substance that you dole out in equal proportions. Love is the relationship, and each child is different, and it evokes something differently from the parent, and it evokes something differently from the environment, which is, I think, what you're saying, Peter, that, a person with this temperament evokes a different response from the environment than somebody with that temperament. Okay. I agree. And not just pathological deviant temperaments, let's say, but just normal variations in temperament. This one's harder to soothe, that one's easier to soothe, that one's more hypersensitive, that one's more resilient, so to speak, right? I think, and this kind of goes back to like Winnicott and other kind of like classic analysts looking at the early care environment. It is the job of the environment to meet the child where they are. And to the extent that the environment is not able to do that, it is a trauma. It's maybe the child's entitled. Maybe the child is colicky and has a really hard time being soothed. Maybe the parents are depressed and financially strapped and, working 2 jobs and all the rest. I'm not here to assign blame, but simply to say that when the developing child is not met where they need to be met by the environment, that is an environmental deficit, and that is a form of trauma. And it's internalized by the developing personality to produce areas of overcompensation, areas of deficit, disturbances in identity, maladaptive interpersonal strategies, all the rest, I've already forgotten what I was responding to. I hope that was coherent. I don't really remember what the question was, but yeah.
Now, Peter, before I go on to the next question, what were your thoughts on what he just said?
Well, I'm curious if you believe that it's possible for the deficits to exist from the get-go, meaning, if there's a deficiency based on a sort of innate propensity, that even the good enough parent, Winnicott's good enough parent, might not stand a chance against somebody who just can't seem to be a good fit for that parenting. And it's not necessarily that there's an injury per se, but there's almost like an inherent rejection of that style. That's not that's not necessarily injurious to the person. It's just sort of like they don't. I think Daniel Stern talks about this, like parents being a good fit or not, and it's sort of like a lottery. I'm just curious if you think that there is any predisposed deficiencies, that could be the reason why something couldn't be cultivated, even in a good enough environment.
Yeah, I see what you're saying. Yeah. So like, in other words, the heritable factor, such as it is, insulates the child from, in like a negative way, from what the environment, even the best environment could provide.
Yeah, or good enough. Like maybe there's a perceptual gap from the get-go that makes them unable to perceive even the good environment as loving. I mean, maybe they do perceive it as rejecting or dismissive, but it's not actually.
Yeah, I mean, I could grant that possibility. I think I would think that for the most part, maybe there's a kind of proportionality to heritable and environmental factors. The higher the heritable propensity, let's say, the lower the amount of trauma is required. The lower the heritable propensity, the higher the amount of trauma is required. And it's a pretty gross reduction, you know. I mean, that's just like, that's kind of taking a you know, kind of hacking it up a little bit. But I think I would agree with that to a certain extent. I think, you know, especially if we're looking at psychopathy, let's say, there's pretty robust, you know, brain imaging evidence that psychopathy, you know, has to do with like lower amygdala volume and stuff like that. You know, that just the system itself, it takes more to produce excitement. It takes more, that the stimulus threshold is much higher, which leads to sensation-seeking behavior, which leads to a kind of insulation from, you know, like societal norms, you know, internalizing those, which leads to a kind of a basic adversarial or antagonistic stance toward people, etc., an instrumental use of them toward power and dominance. So, you know, yeah, I mean, I could see how, at least with psychopathy, something like that could be possible. And to the extent that pathological narcissism and psychopathy overlap, which I think they do in some instances, I could see, you know, that also being a factor. Yeah.
So how about this here? I know when I listen to you both, I think you'd also have a bit of a disagreement on this. Mark, you believe that it is more of a defensive thing a lot of times when narcissists act out. And Peter, you believe it can be much more offensive in nature and intentional. So why do you believe that, Peter? Then I'll give Mark a chance to respond.
Well, one of the reasons I believe it is because I think both clinically, professionally, and personally, I've experienced the intentionality of exploitation and types of behaviors that really don't factor in the harm that they're going to cause the other person. It's sort of like a means to an end. Like I have a need, I have a desire, I have a want. I'm going to find a way to make that happen for myself. And there's not an internal brake pedal, like enough empathy or enough conscience online. It's like the conscience is ineffective enough in those moments for the person to really be self-serving enough. I think that that's certainly directly related to what we would consider narcissistic. And so that's one thing. I think just experience lends itself to the possibility that there's, of course, we all have defenses. We all have defense mechanisms. We have ego defenses that develop out of necessity. But I also think that we have offensive strategies that are strategic out of necessity, from our, you know, our evolutionary history. I think there are times people have needed to be self-serving and ruthless to the extreme to survive. I don't believe that narcissists are completely walking around all the time unconsciously defending themselves as a result of the injuries they suffered. I believe that sometimes they are very clear and conscious about what they are doing, and they do it because it benefits them. So I'm not saying that there aren't defenses at play. I would say that it's not just defenses at play.
What are your thoughts, Mark?
Yeah, I would agree, except I would say that the parts that are more offensive, I see them as the products of distorted self and object images. And a psychological difficulty in appreciating that other people are themselves subjects in certain states of mind. So the term for this would be mentalizing, basically. Understanding that what's in my mind is not the same thing as what's in the other person's mind. Understanding that if I inflict harm on a person, that harm has lasting consequences and can't be magically erased or undone or obliterated by simply shifting my mental state. And this is not just for people with NPD, but this is an issue across personality disorders. So it's not all defensive, but I would say that the parts that are disordered, that we would recognize as disorder, stem from underlying instabilities and distortions in self and object images.
What do you think, Peter?
Sometimes, because one of the reasons that this is actually really like important, I think, to address. So I'm glad we are. But I would say there have been times when, in clinical practice, I've been working with these individuals, and they, in moments of clarity, they very much admitted how much they felt justified and entitled to retaliate following not a defensive reaction, but sort of like time has lapsed. There's no more threat or perceived threat. Now I have the sense to want to do this thing to this person. As long as I don't get caught. I'm not concerned with being bad so much as being perceived as bad. And so I would say that, can we call that a distortion? Yeah, I mean, certainly. But I also think that I think some of these individuals absolutely wouldn't want to give up if it is in fact a distortion, or even, let's say, a mentalizing deficit, like an inability to mentalize properly. They wouldn't give it up for anything because it works for them. And so they're benefiting from it. It's not just that they're suffering or in distress and then this is a reaction. I would say that there's a lot of primary and secondary gain for being this way, because it gets these people what they want in a lot of ways. And I don't see them all the time as walking around as these sort of dissociated victims of circumstance, so much as they are getting pretty clear and strategic on how they can manipulate people. I've experienced these individuals that we would call personality disordered admitting to, like, preferentially targeting people. Again, this operates on a continuum. Not all of these people are malignant, but if they can get away with it, fine. And that doesn't really rattle them. And this is why I would consider these individuals different than, like, the people that we typically refer to as neurotic, who have these internal conflicts. They have all the same defenses, Mark, that you're talking about. They have all the similar injuries, but there's just something a little bit different about them in their operating system that makes it okay for them to continue in this way despite severe consequences even to themselves. And I've experienced them admitting to it being something that kind of works for them. So there's a conscious and deliberate aspect of it that can become automatic and habitual. But I just don't see everybody operating from defenses. I think that there are some exceptions to that.
Yeah, I think this kind of, again, gets down to what, like, we call disorder. I would say that it is what you're describing, the inability to sort of learn from experience that to my mind is symptomatic of the lack of a reflective capacity, basically. Again, these are ego functions that are either not there, or they're there inconsistently or insufficiently. The ability to bridge reflectively between different self states. That I do conceptualize as the function of trauma and dissociation. But, you know, in other words, splitting, right? The person is grandiose and entitled and engaged in a self-justified retributional fantasy, right? You know, I'm going to get this person back because they didn't pay me a compliment at the Christmas dinner or whatever it is, you know. Okay, you know, but then what I'm saying is there's also typically complementary split off self states that contain other constellations of experience and behavior, thoughts and perceptions, self and object images. So it's a dysregulated system that I would say is the personality disorder. Not necessarily the presence of certain traits, but rather the internal incoherence. And you know, there are different flavors of it, of that incoherence. The one we happen to be talking about is NPD.
I think a good question to explore that will go deeper into this topic is, I think you both have some disagreement about the heart of narcissism, or what fuels narcissism. So Mark, what do you think is the heart of pathological narcissism?
The heart of pathological narcissism. Well, I guess I would say it's identity disturbance. So it's the pathological dissociation of grandiose self and object images and devalued or collapsed self and object images. So that the person is in pieces, fragments, and those fragments don't communicate very well together. And the person can't reflect very well across different self states either, which produces disjointed, internally inconsistent behaviors that often look like deception. Sometimes they are deception. I mean, I'm not saying they're not, but it's more a person in pieces. They may spend more time on this piece or that piece, depending. If we're going to say they're more grandiose, then they spend more time in that kind of grandiose self experience. If we're going to call them collapsed or vulnerable, well, then they spend more time in the other side of that dichotomy. But I think the field, or at least parts of the field, are converging on defining pathological narcissism as a higher order, dysregulated system. It's, in other words, it's not just the grandiosity, right? It's not just the collapse. It's both. You need both to produce a disordered system that we would call pathological narcissism. So I guess that's what I think kind of the engine is underneath of it. We could get more specific, and I would say, well, there needs to be a grandiose component. I conceptualize the grandiosity as primarily defensive. That this is a defensive self-image that's there to protect against something. To not just protect, but also, like Peter said, to help the person get their needs met, right? But for it to be NPD, there needs to be an inherent instability. That's what makes it different than just a trait. The grandiose self-image tends to collapse, sometimes frequently, sometimes very rarely. And when it does, it produces dysphoria, depression, anxiety, suicidal ideation, attachment anxiety, stuff like that.
And Peter, what do you think is the heart of narcissism, or what fuels narcissism?
I would say it's excessive investment in one's image at the expense of any authentic self. And I think what causes the investment in the image at the expense of the authentic self, or the failure to cultivate a a self underneath the reflection in the pond, right? We're talking about Narcissus, where I don't think it's from injury solely. I think if you have a degree of grandiosity that is like so severe, I think that obviously what's missing from that, right, is if you're overly grandiose, you don't really have a concept of equality, right? You can't see other people as equal. I also think, as I'm thinking out loud here, so I'm going to go on a little tangent, but I promise it's related. There's a difference between the borderline and the narcissistic personality organization, and what I would say, there's a difference between those terms and like NPD and BPD. I'm not sure if you differentiate between those, or Mark, or if they're all the same. But we talk about the kind of what you're describing is like the lack of the integrated self and the splitting. I'd say people who aren't pathologically narcissistic experience all of that. They experience the dysphoria, the insecurity, the inferiority, the feelings of needing to compensate, the extreme sensitivity, the paranoid anxiety. But I wouldn't refer to all of those individuals as narcissistic in the way that I would refer to somebody who has NPD. So I think maybe we can sift through that a bit too.
Yeah. I mean, the way the way I think about it is kind of a combination of object relations, self-psychology, and contemporary relational perspectives, but also with some trauma psychology thrown in there for good measure as well. I draw a basic distinction between like immature and mature personality organizations. So another word for that would be borderline organization versus like neurotic organization. I think the thing that marks the difference there is diminished ego capacities in the borderline range versus more integrative, meaning-making capacities in the neurotic range, which is why people in the neurotic range do experience all of those, agonies, but they tend to use them in more healthy ways, affiliative ways, seeking support, doing art, going to the gym, telling a joke, stuff like that. They are able to organize that experience as opposed to fragmenting in the face of that internal distress, the paranoid anxiety. As far as different structures between BPD and NPD, I think I would say that the difference, and this is kind of Kernberg now, I guess, but the difference to my mind for narcissistic structures is that there's the presence of a false self. I conceptualize the false self as a dissociative isolate, though. A very narrow range of motion where there isn't identity diffusion and there isn't, the person isn't subject to the disorganizing forces inside of them. In other words, it's like, as long as I stay between these lines, I'm good, but as soon as they get kicked out of that narrow range, that now they're drowning in the water again, that the identity diffusion that surrounds that false self experience. So I don't want to get too analytic here. I mean, it's going to lose the audience, but I guess, what I'm saying is, I think for narcissistic structures, they are essentially borderline with the addition of this grandiose compensatory space where they can sort of operate. But that is a fundamentally inauthentic experience. It's based on contingent self-esteem. What do you need me to be? What does the environment need me to be for me to get what I want, or for me to be good, or for me to be, whatever it is?
And what are your thoughts, Peter?
Well, I guess I would have a question. So that derives from these attachment ruptures in early development. It doesn't derive from like deficits that could already be present?
Well, I think that the deficits could be present, but that then they're elaborated by experience, right?
Okay.
I thought of this the other day. I was kind of thinking about this, and I was thinking about like there's this parasite called toxoplasmosis that cats carry.
Mm.
It exists in the life cycle between like rats or rodents and cats, right? So it gets into a rodent, and it takes the rodent's fear of cats and turns it on its head. Instead of being afraid of cats, now the rodent is attracted to cats, right?
Mm.
It's because they're more likely then to be eaten by cats, and then the parasite can complete its life cycle inside the cat.
Mm-hmm.
So that's a pretty like discrete, biologically driven behavior, right? We can isolate the parasite. We can say this parasite right here, we see it under a microscope. It's causing the rat to do this thing, right? So that maybe that's the heritable component, let's say. But even if we grant it that much coherence and that much power, there's still no problem without the cat, right? You still need for there to be an experience that the cat has to be there. Otherwise, the rat goes on living its life just fine. It's just aberrantly attracted to cat pee, you know? But there's no problem until the cat shows up and eats it. Right. So that's, I mean, this is kind of like, I guess what I'm trying to do is draw an analogy, right? Where even in a situation where there's a robust, identifiable, discrete biological driver, there's still no problem without trauma.
And what are your thoughts on that, Peter?
I'm following. I like it. But I would also wonder, does it have to be trauma? Maybe it just is interaction in general. You know, I had a professor say, like, you wouldn't know, you know, if you put somebody with, just hypothetically, if you put somebody with BPD or NPD on an island, you wouldn't really know that they were. And so obviously you need the interpersonal. I mean, well, especially when we talk about cluster B pathology, we're talking about the distress within the individual as well as the distress that they cause. Typically happens in intimacy, right? It happens in interpersonal dynamics. So obviously you need that environment. I'm just thinking, are you open to the possibility that regardless of somebody's upbringing, if they have this propensity, not, again, I'm not saying it's deterministic, but if they have this propensity to see things more like, it matters more, I matter more than anything and anyone else. Do you believe that can manifest interpersonally in the absence of trauma?
Well, I think I don't want to narrow it down just to the example you gave, but based on the example you just gave, and I'm going to rely on your kindness here because the example I gave was about rats and cats. So, you know.
Sure.
but based on the example you just gave, I guess I would say I would doubt that such a coherent perspective is heritable. I would see that perspective that I'm more important than everybody else as already multi-determined, already the result of many different factors and experiences. Some of them biological, sure, but many of them not.
Mm-hmm. Okay.
Well, and I guess another way to ask kind of a very similar question is, so Peter, you have said before that it's a myth that all narcissists are insecure, because a lot of people think the root of narcissism is in insecurity and overcompensating for that insecurity. But could you expand on why you have said that?
Well, that's sort of a play on words. It's intended to be a bit provocative because I think if there's one exception to any theory, then we need to consider that exception, right? Does there exist a narcissist who's not insecure? I think so. There's research that is pretty clear on that. That if we're talking just strictly narcissism, is one of the prerequisites or causal factors to be that it's stemming from insecurity, not according to all researchers. So I would say that there are narcissists who meet the criteria for NPD, who don't necessarily walk around compensating for their inferiority or feeling insecure. I would say that they do exist. I think that there are also narcissists who have insecurity. What the research that I typically support shows is that that's not considered a central feature of narcissism or of NPD. It is considered a central feature of the narcissistic personality structure or organization. But when we talk about NPD, and then we can talk about the DSM and NPD, and I know, Mark, you have your thoughts on that criteria. My understanding of the NPD criteria is that the first two editions of the DSM eliminated kind of the anecdotal evidence in favor of more measurable, statistics and control. So I would say that it's not. I wouldn't consider it antiquated. I would say that it's factoring in the reality that there are narcissists who are both insecure, and then there are ones who actually are pretty pleased with themselves. And I don't think that the pleased with themselves factor is because they're in denial of anything. We might always disagree on that. But to answer the question, I do believe there are narcissists who exist who are not insecure in the slightest.
And what are your thoughts, Mark?
I think we are trying to kind of like, I don't know. I have this image in my head of like us on like these platforms that are attached to stilts, and they're kind of wobbling around. I think there's so much disagreement in the field about what these constructs are, not to mention then how they're measured, and then on top of that, what kind of conclusions we draw from them. I mean, this goes on, like if we're just talking about in the clinical literature, it goes back to the 1960s, right? The Kernberg-Kohut split, right? And many people said, oh, well, they're treating different populations. Many people said, oh, well, their theories are fundamentally irreconcilable. Okay, now we're talking about the heritability experience split, right? Fine. I think this is a disorder that coheres bimodally. And what I mean by that is there is a coherent sort of clinical picture on the grandiose side of things, what I think Peter's talking about right now. And then there's a coherent sort of clinical picture if we think about it as a syndrome that involves self-esteem dysregulation. I think the research suggests that more grandiose stereotype or version, the one without insecurity, let's say, or without visible insecurity, is exceedingly rare. By some estimates, less than 1% of the general population. Whereas the other one may account for up to 20% of the outpatient clinical population. So one in terms of scope, one is much larger. Also in terms, I would say, of clinical utility. In other words, what can we derive from this model that will help us to accurately identify clinical phenomena and then treat them? I don't know if we're talking about the same population, Peter, or if we're talking about different populations when we talk about those two bimodal, what do you call them? Syndromes. Mm-hmm. I know that for the most part, the DSM model has constellated around that more grandiose construct. Ways of assessing NPD have followed from that model. So we've got like the NPI, Narcissistic Personality Inventory, used in 76% of all research up to 2010. I don't know since then. And that, arguably doesn't even measure pathology. It measures something more like, trait narcissism. DSM-derived diagnostic interviews that are used in lots of the twin studies, that again might just be getting at this kind of overconfident phenotype that's maybe based more on heritable factors, but not necessarily the full syndrome, which to my mind has to include the vulnerable facets of the disorder. But again, we might actually be talking about two different things.
What are your thoughts, Peter?
I think we're talking about two different things. Yeah. I think, and I'm not saying that one of us is right or wrong, but like when I hear you speak about what you're describing as the 20%, I would consider that certainly not benign. I mean, obviously, when you talk about the risk of suicide, the depressivity, those factors, devastating for the individual and life-threatening. What I would say though is I would consider that probably more related to like neuroticism, even though there's that fracture of self, right? That could be, and there's a distinction between the borderline organization and the neurotic, and neurotics are, let's say, more stable. I still think that the type of narcissism that, and maybe we need to talk about the difference between what Daniel Shaw, I don't know if you're familiar with Daniel Shaw's work, but he talks about the traumatizing narcissist versus the traumatized narcissist. I think when I'm conceptualizing narcissism, I'm focusing more on the result of the interpersonal problems, right? Like what this brings to the table versus what it's actually doing to the individual. I think that's probably why we're talking about two different things.
Yeah.
So.
Yeah. Well, I think that gets into this, the topic of like narcissistic abuse and, the interpersonal dynamics that can develop. That might be worth talking about too. I'm sure we have some areas of overlap and difference there as well. I mean, I know that a lot of I would say like 99% of the stuff online that talks about narcissism really focuses in on that. But I'm open to talking about it if it feels
well
an important topic.
I think the 99% of that you just referenced, I think a lot of people are talking about narcissistic abuse or using the term narcissistic abuse to describe something that might not even have anything to do with a narcissist. But I guess my point to that was to say, or I guess it segues into a question I have for you. Is there, in your mind, is there a distinction between, or do you even consider this relevant or legitimate? Like when we talk about the dark triad research, obviously these aren't diagnoses, but there's narcissism in the dark triad, right?
Yeah.
Is that the narcissism you speak of when you call pathological narcissism? Are those?
No.
Okay.
No. Yeah. Although I mean, I would say that like that dark triad or malignant narcissism, let's say that includes a narcissistic component or a component of pathological grandiosity, which is a part of narcissism, right? But I think when I think about pathological narcissism, that's a very broad construct for me. And then when I think about NPD, I'm thinking about that more as like a more specific instance of pathological narcissism that occurs at the level of personality, basically, where the whole personality is organized around the pathological narcissism. But I think pathological narcissism can show up in other syndromes as well, and other disorders. Yeah.
Well, Peter, you had just said that when people say narcissistic abuse, you think they're not even really referring to narcissism. What do you mean by that?
Well, most people, whether they like it or not, don't really know what narcissism is. So when they use the term, they're using it as sort of this umbrella term to describe anything from a disagreement in a relationship to an isolated behavior like infidelity or deception. Things that everybody can be capable of to a degree that aren't necessarily exclusive to narcissism. Most of the time, though, I've seen this use of the term to describe anything from psychosis to psychopathy. I mean, there's a broad range of how the term is used generally by the general public, and I think it's become a term to describe anybody who feels wronged or slighted interpersonally by someone. Then that person is a narcissist, and that's ridiculous. So,
Peter, if we were in the same room, I'd give you a hug. You speak my language.
Yeah.
So Mark, I know, Mark, you don't like the term narcissistic abuse, and maybe you could explain why you don't like it.
I just feel like it's unnecessarily stigmatizing. We don't have like borderline abuse or histrionic abuse, or I mean, any disordered system of thoughts and behaviors can produce an abusive interaction. I mean, mental disorders are called that because there's something going wrong inside the person's mind, and that can very easily produce all kinds of unfair, selfish, insensitive, outrageous, unrestrained, behaviors. I think when I think about, okay, if I had to like force myself to define narcissistic abuse in a way that's clinically coherent, as opposed to just I feel mistreated and this is a label I'm going to put on it. It would be the instrumental use of another person for self-esteem, essentially. It's something that in the literature is called using someone as a self-object, and it's something that little kids do. You're supposed to. That's how you build a self, But when that persists maladaptively into adulthood, well, it's maladaptive, and it makes the people you're around feel invisible and used, and it can result in really insensitive, entitled behavior. And yeah, I mean, that's fair, but I wouldn't call it narcissistic abuse. That's just such like a stigmatizing frame, and one that equates a mental disorder with abuse, and they're not the same thing. I think it's very possible for somebody to have NPD and to not be out there abusing people. In fact, I think a lot of times people with NPD they abuse themselves because of their perfectionism, because of their internal fragility, because of splits between omnipotent, grandiose expectations for themselves, idealizing of relationships, and then the other side of that coin, which is the collapse, into depressive suicidality. I've worked with lots of people who I diagnosed with NPD, and their primary presentation was, I'm just not doing it well enough. Their interpersonal experience still dominated by feelings of envy, right? There still being a kind of chronic absence of empathy, because they're so hyper-focused on what everybody else has that they don't. But the narrative conclusion that's drawn from that is, I'm not good enough. If I were just better, then I'd have all those things.
So, Peter, what are your thoughts on the term narcissistic abuse? Do you find an issue with it, or what do you think?
I find issue with it because I think it's misleading, and it's not accurate. I agree with Mark on that. It's inaccurate to describe, I think, what people are attempting to describe. First of all, like all kinds of abuse that don't involve narcissists can if you really look at what people are calling narcissistic abuse, could fall under that category. And so it's misleading to refer to it as narcissistic, exclusively narcissistic abuse. I think there was something that you said, Mark, that I wanted to comment on, but it's left me.
When I said the word envy, there was like, you had a reaction. So was it something related to that?
Something about narcissists not always being abusive to others, and sort of they can abuse themselves. Yeah, thank you. I think that you run the risk for a lot of people. It's really hard for them to hold both of these at the same time, where somebody is inflicting a lot of pain onto somebody else. I would say both defensively, but also intentionally at times, right? Because they matter more to themselves than you matter. But I would also say there's this idea when we use narcissistic abuse that the narcissist is completely malicious, void of distress, in a way where they're like conspiring constantly behind the scenes, and then they can't wait to get you. I don't believe that people who are narcissistic are walking around like that. And I think narcissistic abuse, that term, there's this meaning in it that's what people think is going on. That from the moment they wake up, and even when they're dreaming about conspiring to destroy people. I don't believe that. I believe there's actually something, and I'm borrowing this from a gentleman named Gregory Lester. He talks about the difference between passive and active grandiosity. And a lot of narcissists are passively grandiose. Psychopaths are typically more actively grandiose, meaning if they feel wronged or slighted, they're going to show you, right? They're going to retaliate in a very cruel, callous way. I don't think that narcissists, I think that's what a lot of people think narcissistic abuse is. And I wouldn't agree with that. I wouldn't agree that it's this constant, conscious conspiring to destroy and decimate somebody for the sake of pleasure. So that's why I'm not really a fan of that term.
I just think it's misleading. Yeah, it doesn't lead us in a helpful direction ultimately. Yeah, and it's so easily misunderstood. You know, it's like the term narcissistic supply is so easily misunderstood, so easily converges on something more like emotional vampirism. You know, the predator and their prey, as opposed to this idea that this person has a deficit in their ability to maintain a viable self-experience, and they're actively trying to lean on literally anything in the environment, you, somebody else, their accomplishments, how they look today, whatever, to try to make up for that deficit. It's more characterized by a kind of desperation that's habituated. It's not like I'm desperate, but like, you know, it's become this kind of like, well, this is just how I operate, you know, than it is a predatory instinct or smelling blood in the water or whatever, you know.
That makes sense. And Mark, in the discourse on narcissism, what would you like to see change overall? Like, what are the things that you see people doing and saying that you just think aren't helpful, or maybe they're overly stigmatizing or demonizing? What do you think they are?
Yeah, you know, I think, well, Peter started off talking about like a kind of a spectrum or a continuum. And I think I would just like to see that foregrounded, you know. Not a continuum in terms of disorder necessarily. Well, there's the mild narcissist and the severe narcissist. Not that so much as the recognition that we're all people. I don't think about NPD as a different kind of person, and I think a lot of people do. I think about it, as I've said, as a dysregulated system that produces dysfunctional behavior. There was a video that I made a while back that I kind of ended with this by saying the following. Oftentimes this is reduced down into this idea of us versus them, but they are us and we are them. We're all people, and we all have, our need to feel important, our need to feel seen and valid, to feel successful, to feel powerful, right? We all deceive from time to time, sometimes in bigger ways, often in smaller ways. We all have dysregulated behaviors. We all shit the bed sometimes, so to speak, right? Hopefully not literally, but, I don't know. There's lots of people in the world, right? I guess the point I'm trying to make is these aren't necessarily differences in kind so much as in degree. And the more that we can recognize the fundamental humanity of whoever we're talking about, the less polarized we're going to end up, the less pushed into these separate corners, good versus evil, heritable versus trauma, grandiose versus vulnerable, narcissist versus empath, all this Peter versus Mark, and begin to really come together, to hold accountability and compassion in the same breath, basically. I think that's what I try to do on my channel and in my clinical work. And I think that's really what we all need. Narcissists need it internally, that coming together of different parts, less polarization, right? Less blame. Socially, we need it as well. Less us versus them, less in-group versus out-group. More recognition of our shared humanity.
So what are your thoughts on that, Peter?
Again, I had something in my mind and then it left. What I'll say is I do think, I think there are people in this world who behave in ways that it makes it seem like they are a different species, because it's so shocking and startling to what we collectively have decided is appropriate, that to hear these things that people do. And so I've never used the term evil, good and evil. I've never dichotomized in that way because I don't want to bring that into it. But I think there is space to hold like this collective compassion for humanity, but at the same time, there are these whatever you want to call them, outliers. There's people that are capable of some pretty horrible stuff. They don't seem like they're stopping anytime soon, and it almost works for them. And you couldn't pay them to give it up. And I think that's really, I think there is an intentionality to that in many people. I think people have been invalidated a lot by being told that this isn't something that happens to them. This is something that they're kind of co-creating. So I do want to make a distinction. I think, Mark, I don't know if we would fully agree on this. I watched your interview with Brad Carr, which I thought it was a great interview. I think at the very end, there was a question about, I think he sort of asked you, I'm paraphrasing, but do you think that people, intentionally exploit? And your response was sort of like, if that's the case, the other person would also likely have some pathology too, if they're kind of inviting that in to their life and kind of relating to it on a longer term basis. I would disagree with that. I would say that that separates us. I think there are people who don't necessarily have dysfunction, but maybe give people the benefit of the doubt a little too easily, and they get blindsided by some of this exploitation.
Yeah, I certainly think there are situations where somebody is a victim of abuse. Like, just want to be very clear about that, right? I think at the same time, relationships, especially long-term relationships, are incredibly complicated. And we often find ourselves gravitating toward what's familiar, whether we do so consciously or unconsciously, in an attempt to try to solve the problems of the past, the unresolved conflicts, dad never paid attention to me. That's what feels like love. Now I find myself in a relationship with somebody who seems to pay attention to me, but still on some fundamental level, I feel invisible, that kind of thing. I think when we're talking about like the extremes of a spectrum, yeah, those are always going to kind of seem like differences in kind, by virtue of their extremity. But you still get there along the continuum. We could argue, and I think it would be a valid argument, whether or not at some point that transition actually results in a difference in kind. I think it would be more philosophical at that point. I think I always try to foreground relationality, but I absolutely recognize that there are situations where somebody is just straight up being abused and it's terrible and they need to leave. They need help. And it's not because they asked for it or, something ridiculous like that.
I mean, one thing I've thought about is in the way people talk about narcissism, it does seem to help a lot of people, though. So you might consider it, Mark, more of a demonized, stigmatized view. But at the same time, it does give people a lot of clarity, it would seem. It would help them to kind of wake up to maybe what their parents were like or their last romantic relationship was like. And that does really seem to help them. So how do you square that with the way you would maybe see it, where you would think, well, maybe that's a little more demonizing, stigmatizing towards narcissists.
Yeah.
How do you square those two things?
Yeah. I think we all need to go through our own individual processes of reconciling, our experience, right? Sometimes that involves being really mad for a while and looking at things in a black and white way. Sometimes that involves mobilizing, all of your energy into a kind of a crusade or a kind of campaign, where you're like a member of 80 different narc abuse forums and, watching all the channels and, that's like make it your identity for me. Sometimes people need to do that just to mobilize whatever it is they need inside of them ultimately to make a correction in their life that's for the better. I would say that's not the end of the process. I think a lot of people get stuck there. I've never made it my business to try to tell people who I'm not working with in a clinical setting, how they ought to feel about somebody who hurt them. And in fact, I don't even tell the people I don't even tell my patients that. I don't feel like it's my purview, right? I won't presume to know anybody's individual situation. When I say that we should approach these issues with more compassion and in a more integrated relational way, I'm speaking collectively here. I'm always talking about our cultural stance to this issue, not anybody's individual experience.
What are your thoughts, Peter?
Yeah, I would agree with that. I would agree. I think collectively, if we vilify anything, we're contributing to the dichotomous nature of these extremes. It's not really going to do much good. I did a post about this. I got so much heat for it because I was accused of being lukewarm, which I take as a compliment. Where even politics isn't about politics; it's about these extremes, right? Like people think they're arguing about content, but they're arguing through their own process of extreme. If we want to correct this, if we want to call it a mental health crisis or an epidemic or whatever, it's been referred to as that. Narcissistic abuse is like a global health crisis. If we want to correct it, it's not gonna do any good to play that same game that I think is almost inherently narcissistic. They're bad, I'm good. They're right, I'm wrong, or whatever. I'm right, they're wrong. This polarized view, I think, is problematic. So maybe that's a topic for another interview. But treatment and correction of this micro and macro. But yeah, I would agree that's not super helpful. I do think it's helpful for people, though, to understand that there are people who kind of go about relationships in a way where they subjugate, and I think it does help people make sense of their experiences, so that it's not completely. I think it's important for people who have been, legitimately victimized to know that, there are people who victimize others. I think that's part of human nature. I don't think it necessarily has it doesn't need to be more, anything more than that. So.
Yeah, I agree. I think you can find people who are victimizing others in any category. It doesn't have to be NPD. I get a lot of heat too. A lot of accusations that I'm a narcissist apologist and I'm enabling abusers, and to my mind, I'm just like, well, I'm just trying to responsibly communicate what I see the literature is saying, trying to increase nuance and complexity in these conversations. But I think a lot of people, they just kind of get stuck in this polarized, externalizing way of coping, and that is a kind of pathology to my mind. And it's not so different in kind from what we're talking about in the cluster B range. A reliance on projective defenses and splitting and externalizing. But I'm not saying they all have personality disorders. I'm just saying when we're shaken, we tend to regress down to a less adaptive mode of negotiating experience. Some people are stuck there for life, and I would say they have a personality disorder. Yeah.
So I know we're about out of time here, but any other closing thoughts from either one of you about just how you both talk about narcissism moving forward? Any suggestions, for lack of a better word, for each other?
Well, Peter, no. This is actually, I found this to be very helpful. Prior to this, I knew Peter through his channel, and I watched your interview with Brad Carr as well, and with some other folks. I watched a couple interviews between you and Jared, and I think it's really helpful to get kind of together in this virtual space and to just talk about these ideas. I think, maybe it was off camera before we started, but Peter said something to me like, I think we have more common ground than people expect. And I think it seems to be true. It seems to be true that we do. We each have like our little domain, like our constellation of concepts that we talk about more. But I've found this to be healing in its own right. To see that, you know, we can come together, recognize differences, talk about them in a civilized and humane way. You know, acknowledge areas of agreement, and nobody has to get thrown out in the garbage. You know, nobody has to be accused of being a narcissist or a psychopath or whatever.
Yeah.
We can just have differences, you know, and areas of agreement, and we're just two people, and it's great.
Closing thoughts there, Peter?
I second that. I agree. I kind of anticipated that it would go this way, and I'm pleased that it did. I think hopefully it'll speak to a lot of people who value what we both, you know, bring to the table, and maybe we can inspire some, you know, integration. I don't know. Maybe I shouldn't say this on record, but maybe there's a collaborative book in the future or something where we bridge this gap.
Yeah.
But you know what I'm saying? Like, it's, the discussion can keep going, and I think it should be open, and it's exciting, and it doesn't have to be, you know, and like you said, it doesn't have to be anything other than two people, you know, bringing to the table their backgrounds and their perspectives, and having a conversation about something that's important.
All right. So, Mark, where can people find more of you if they want to check out more of your work?
They can check out my YouTube channel, Heal NPD. And I also have, I put up a lot of my stuff on a podcast as well called Heal NPD. My website called healnpd.org. I also, you know, my practice specializes in pathological narcissism and NPD, other personality-based issues as well. And for anybody in California who's looking for services, we have openings. I've brought on a couple of associates, and they work under my supervision, and they're building up their caseloads. So now's a good time. If you're in California and you're looking for some help, healnpd.org.
All right. And Peter, you?
Yeah, I have. I'm on social media, obviously, Instagram, YouTube. I have a website, drpetersalerno.com. And obviously some books available on Amazon. Mark has a book too. I'm gonna plug that book. I read your book.
Oh, I read yours. Well, one of them. You've got so many, and this is just. I'm in awe of you're prolific, and I wish to learn from your ability to churn out the books.
Yeah. I appreciate that. But yeah, that's where you can find me. Yeah. I think that's about it.
Well, I'd like to thank you both for coming on the show here. I think it's a very interesting discussion. And I think this one here was kind of more breaking the ice, I guess, more to speak. And maybe you'd both be willing to come back again now that the ice has been broken, to like just have another discussion in the future at a point.
Yeah, this is great.
Absolutely.
All right, guys. Thank you again for coming on. I appreciate it.
Thank you, Jared.
Honest.